Do you go to bed the same time every night? Do your kids? You probably should. Obesity is the second most common cause of preventable death after smoking, right? So no smoking either. All right. There are many causes of obesity, but a new study shows that toddlers, if they have an irregular bedtime at age 3, they have a nearly doubled risk of obesity by the time they are 11. Of course, this is an issue for adults, too, and that's why we're talking with Dr. Conrad Iber. Dr. Iber is the medical director for the Fairview Sleep Center. Dr. Iber, thanks for staying up late with us tonight.
Well, thank you for having me, Jordana.
You probably go to bed around this time or maybe even earlier, right?
I'm an early bird.
Okay, I don't blame you. Well, again, I appreciate you staying up with us late. So tell me a little bit about the study. This was a study of young kids, correct?
This, as you said, it was toddlers, 3 years old, who were followed for 11 years, nearly 10,000 of them in Britain. And there are similar studies in the U.S., by the way, and New Zealand. And this issue of kids not having enough sleep with irregular bedtime seems to be at least a substantial contributor to the risk of obesity. These kids were followed to the age of 11, and as you pointed out, nearly had double the increased risk of obesity at that age.
I always wonder, what are the other factors, though? Because, all right, I think regular bedtime. When my kids are 3, they're a little older now, but when my kids were 3, you do your teeth, you read a book, you tuck them in, you probably have to stay with them for a little while because, they don't want to go to bed. You have to get them 1,000 glasses of water, and then you hopefully put them to bed. Now, obviously, a lot of, engaged parents are doing this all over the world. So the ones that aren't as engaged are not doing it. So that doesn't matter to them if the kid goes to bed at that time or an hour later or passes out, watching TV with you or that kind of thing. So is there also a difference between engaged parents and less engaged parents?
Well, you hit the nail on the head there. Although we certainly, in a lot of these studies, including this one, associate sort of chaotic schedules in the evening, the use of television and video, habits of parents are very important. If parents tell their kids at any age or older age that there's a regular bedtime, the kids are more likely to follow through. And if parents have a regular bedtime and a regular routine, you pointed out a really good example of a good routine in the evening at a kind of a specified time, it's more likely to happen.
The study also says, watching TV or irregular meal times also led to obesity. Does it all go back to the parenting?
Well, I think obviously there are genetic reasons why some people are more likely to be overweight. There are lots of other factors, but these things that we set up in childhood in terms of habits have profound impact throughout the ages of childhood and even into adulthood. One study in New Zealand followed people to the age of 32, and in these habits at an early age, the hours of sleep they got at 5, 7, 9, and 11 predicted being overweight at a later age. So what we do early is real important for kids, and that, I think, is throughout all the ages, but particularly important early on.
Let's talk about us grown-ups now. Hopefully the kids are long gone to sleep, 10:42 at night. It's a little bit late for them. So what then do you tell your patients? Is it equally as important as a 40-year-old person to go to bed at the same time every night? And how much leeway do we have with that in relation to obesity?
Well, there's a lot of data in adults. Shift workers, people getting insufficient sleep are much more likely to gain weight. And so this is a factor in adults as well. And you, again, kind of pointing out the important points here, which is regularity and sort of predictability of sleep often makes it easier to fall asleep and to stay asleep. So if you have a very irregular schedule, it can be a problem. For kids and adults, electronic equipment in the bedroom is really the enemy of sleep. So that's a big problem. For kids, interestingly, teenagers tend to use caffeine up until 5 o'clock in the afternoon, and that's also a problem. More than 3 caffeinated beverages and after 3 to 5 in the afternoon are kind of no-nos if you want to get good sleep.
Okay, well, who knows? Diet sodas and stuff could have a whole different effect on obesity, and we won't talk about that right now. But when you counsel your adult clients, Do you tell them that if you start getting more sleep or at least going to bed on a regular basis, that can help in weight loss?
Yeah, it certainly makes it easier. Weight loss is a very hard thing to achieve, and weight gain under certain situations is a lot easier. So it's part of the the components of losing weight are exercise and dietary control, but sleep is an important part of it. And the studies show that people who have irregular sleep habits or insufficient sleep are much more likely to consume foods and beverages with lots of calories. So it actually it changes our behavior. And I don't want to forget that sleep is a brain enhancer, so it has other benefits as well. We're talking about obesity tonight, of course.
What do you think is the perfect amount? I know we all hear the 8 hours, but that seems so unattainable for so many folks.
Depends on age.
Okay.
We'll go back to kids for a second. The American Academy of Pediatrics and the American Academy of Sleep Medicine recommend 10 to 13 hours for 3 to 5 years old. We were talking about 9 to 12 hours for 6 to 12-year-olds and 8 to 10 hours for 13 to 18-year-olds. So there is a little variability amongst us in our sleep need. The best idea you can get for your own needs is what you get in a relaxed vacation. Both the timing and the amount of sleep you get under those circumstances, which is typically around 8 hours, is probably what you need. And that schedule is good to follow on work days if you can.
Sleep, it's so elusive. Oh, my goodness. And I'm sure you're seeing, we're living in a stressful time, Doc. I'm sure you're seeing a lot of folks with different kinds of sleep issues. Give us as adults a good, healthy routine to follow as they drift off to sleep. And please include listen to the Jordana Green Show every night.
Well, certainly relaxation is an important part of it. A wind down in the evening. Again, not having caffeine after about 3 o'clock in the afternoon. Avoidance of bright light within your target bedtime. Let's say your bedtime's 10 o'clock. Then within an hour or two before that, you want to avoid electronic equipment and bright light. Good just not to have cell phones that vibrate at night, or even if they don't have light, or to engage in using cell phones and videos and computers in the bedroom. Good to wind down, and part of that is, not talking with your spouse about financial issues.
Oh, boy, yeah.
So the wind down should be a relaxing time, a quiet, relaxing activity before bedtime.
What about reading? You said no bright lights, but is reading okay with the light on?
Reading's okay with limited light exposure. If you're really sensitive to light, you can buy yourself some amber goggles to wear or glasses to wear in the evening if you have to be exposed to light.
I know so many of us are guilty of falling asleep with the TV on. I know you say it's not good for us, but it's sort of a nice sleeping aid for most of us.
Well, an alternative would be to just listen to some relaxing music.
Oh, I think I heard you say the Jordana Green Show. Yeah.
Oh, yes, that's right.
That'll put you right to sleep every night. Well, Dr. Conrad Iber, thank you so much. Thanks for shaking out this study with us, reminding us about those regular bedtimes for kids and offering some tips for adults. Dr. Iber is the medical director for the Fairview Sleep Center. Thanks again, Doc.
Thank you so much.
Get some sleep.
All right, good night.
You got it. He's an early bird. He needs to get some sleep. He might have some early appointments.